Jan and I recently completed a study comparing two types of wound closure. The number one complication we as surgeons and healthcare providers worry about are wound infections. And so the idea of the study was to compare our previous closure techniques with a new multi-layer closure. And we were looking at how can we, number one, improve patient care and make it a better outcome and also a better cosmetic result. But number two, make it economically viable, both for the patient, the providers, and the insurance companies. Does this help with my patient's experience? Does it make me more efficient in the operating room? And is it cost effective? And I think this study outlined that all of the answers to those questions I have was yes.
So as we look at time as respect to the data as to readmission, with a traditional wound closure, it was approximately 51 days before those patients were readmitted. But as we looked at our multi-layer watertight closure, it was more along the lines of 90 days before they presented for readmission. We had no readmissions in that time frame when we used a watertight closure versus 2.6% when we were doing more of a traditional wound closure. The other thing that we looked at and saw was that their length of stay was diminished. Now up to 60% of our patients are going home same day. The study also reflected that we were having increased ability to get patients directly home and not going to a skilled nursing facility or home health care. It really was important to note that there were multiple points that were statistically significant, and it did confirm that we are definitely moving in the right direction with our wound closure strategy. It does what it is intended to do, and that ultimately the patients absolutely love the cosmesis of their incisions, and they are just overall just pleased.